going on. Right. So today it will be like not only the joint of a, dissection of a joint, but at the same time, I'll show you the way in which we'll be proceeding. And then we'll be watching some clinical aspect with X-rays. These are the X-rays which you have already sent of your either parents or relatives. And I said that why don't you try to diagnose it by yourself, because we have discussed it, right? So in case if you got a problem in that, because all those X-rays, they were of osteoarthritis, and in some case there were some fractures. So today, these are like some very common X-rays which you'll be coming across in your clinical life. Thousands of times, right? So we'll be discussing those X-rays. I'll show you those X-rays, and I think that's it for today, right?
Okay, sir.
So chalo, I think we start. It's
Good morning, sir.
Good morning. It's exactly it. Regarding the emails, some of the very wonderful emails, thank you so much, because all those things, they really encourage that you are there. Yes, very true. The number is
Thank you.
dropping very sharply, right? From 500. See the way it is dropping. Maybe whatever the reason is, but my wish was always that we at least we stay above 150. Now, as it is dropping right now, it is below even 100. Let's hope, because if it drops below 40, so then we stop these lectures, because then it is like it is very less motivation.
Sir, but then won't we get the benefit which we should be getting, like from
I
your lectures?
totally agree, but it is like, say, it is necessary that some substantial number should be there. It is very much important. Last time the VCAP patients still really, the last number was 14 or maybe 17 or 19. And I'm a bit surprised also, though, say, there were few hate mails, there were some very nice, beautiful mails from you. But yes, those emails, like every time it is the same thing. Abhi se kyun radiology padhana? Why in so much of depth? General anatomy is useless. All sorts of things. Because in MBBS, you don't have to cram anything. You have to understand. And these initial months, that's what I say. We are just preparing the foundation. Same thing will happen in even physiology also. So it might happen like that when we'll be spending time on ECG, when we'll be spending time on echocardio, when we'll be spending some time on Doppler, right? CT scan, MRI. ठीक है, in first year, no one can ask you about these questions. No one will ask you that, okay, you diagnose ECG or you tell me the findings of Doppler. But once you see that, you'll be so happy to know that kitna badhiya. When you say that, yes, this is the mitral regurgitation, right? Mitral wall is in problem. And by applying the logic, when you say that, and see, I can explain you that thing in under 2 minutes, right? All you have to understand is Doppler. See, Doppler. Doppler means these are the specific. It means we'll be using the mic. We'll be using the sound, right? Sound of flow. So principle is, this is your microphone. If the blood or fluid is coming towards the microphone, it is red. If it is going away, then it is blue. Simple. It has got nothing to do with oxygen or deoxygenation. It is coming towards you, it is red. It is going away, it is blue. All right. What if here is the mitral wall, right? Mitral wall. So this is a normal mitral wall, right? You will find that blood, when it is coming, you are listening. So it is coming towards you and this is going towards away. But now the situation This is the wall. Over here, you put the microphone over here. The blood will be going away. So it should appear blue. What if it is appearing red? So that means this blood is coming back. If it is coming back, it should not come back. It is coming back. It is coming via this mitral valve. That means valve is not capable of holding it. That means blood is coming back. And this condition is known as mitral regurgitation, right? It is coming back. When we eat something, we regurgitate, means stomach contents, they are coming out. So this is the science. But then we have to apply this science in the direction. So it gives you the visual impression about the what is called as the fluid dynamics. More when I'll be teaching you with examples, multiple types of Doppler and multiple conditions, but the logic remains so simple. That's it. So when they say oxygenated, deoxygenated, no, it is the blood. And how that microphone is knowing or how the computer is knowing whether to put it red or blue? Very simple. Example of train. You are standing over here. When the train is coming towards you, what will be the sound effect? Right? That way. The intensity would be increasing. When it is going away, it will be fading. But it takes care of that only. That's the principle behind the electronics of it. That is, it requires just one circuit. It is called as the RC coupler, resistance capacitor coupler circuit. So there is a resistor, and in series there is a capacitor, and then depending upon the frequency, depending upon the value of these, it will filter out certain frequency, and accordingly it will be regenerated into the form of image. Right? So that's how this is the electronics, this is the physics, and this is how the image gets generated. You have to use that principle for the diagnosis. Right? So that is where the anatomy will come into picture, that it is this point when the blood should be coming towards us or it should be going. Say, for example, this is an artery, right? And you put it over here. So yes, you know that the blood, it is a big artery, it is going. But at some point, you find that there is some blue area over here. So that means the blood is going away. Chances of, is it an aneurysm? Is it some extra vessel? So all those things. Is it some there is SOL, space occupying lesion, and blood is going over there. So that's how you come across various structures. And this is what we'll be discussing in depth when we'll be discussing Doppler. The best fun part is when you'll go to clinics. You'll find everything so familiar. I won't use the word dumb, right? No. But in clinics, at times people use that word. If you don't know about x-rays and the x-ray is given, but when the x-ray is given to you and you start speaking scientifically, just trust me, the pleasure would be across the roof. You'll be so happy. Even the opposite person, if he is sensible and not egoistic, he or she will also be happy. Your teachers will be happy. Yes, they are talking sensibly. This entire base is prepared for that purpose. Now, today onwards, when you'll be watching the knee X-ray knee joint, right? You'll be having a completely different perspective that this is how we are supposed to see. Now, it is possible. Let's say it is ankylosing spondylitis, right? Or if it is some other condition. So you might not be able to diagnose that condition, but at least you'll be able to figure out that these are the areas where there is something wrong, right? So, and in first semester of MBBS first, knowing this much, diagnosing ECG, you should be able to comment on the coronary angiography, right? You are commenting on CT scan, MRI. Eh, that is super satisfying. So that's the purpose, that as we progress, you reach to higher and higher levels. This is like reply to all those hate mails. ये सब तो वैसे फाइनल में पढ़ना ही है. फाइनल में द प्रेशर वुड बी कंप्लीटली डिफरेंट एंड दिस इज लाइक अ सीड. आज आपके दिमाग में एक सीड डाल दिया दैट दिस इज हाउ द एक्सरेज आर टू बी सीन. In 4 years, you'll be watching so many X-rays with that vision and perspective that automatically it will come in your blood, right? It will be your reflex. Reflexly, you'll start speaking, and that makes all the difference. Chalo. So let's start with our topic of joints. This is part 2, in which we'll be discussing classification in brief quickly, so that TM joint or the temporomandibular joint, temporal bone and the mandible bone, right? So when you put your finger in front of your ear, right? External auditory meatus in front of your and open and close your mouth. You'll be able to feel this joint. This is temporomandibular joint, and will be dissecting it. We'll be opening it because it has got some super speciality, amazing speciality. That is what we'll be discussing. Also, this TM joint is one of the important joint for Viva and one of the very important joint for all those exams, that is competitive exams. Some questions, they always pop up from TM joint, right? And then we'll see the clinical aspect with X-rays, right? So that's what it is in our dish. Regarding some emails which were received for conjunct and adjunct movement, you said that can we discuss it again? Conjunct means associated movement. Associated movement means when you are, let's say, that's the knee joint, right? That's the knee joint. So when you are extending the knee joint, when you are extending, right? When the leg is getting straightened, so there would be rotation of tibia also. So even if you don't like it, even if you say, no, I won't be rotating my tibia, it is automatic. That's why it is called as associated movement. Associated movement. There'll be several such movements which are like associated movement. There'll be big practice, or there'll be big involvement of physics. There'll be big involvement of how the nerve supplies, etc., which we'll be discussing during our regional discussion. But it is not, it is absolutely unintentional. That means even if you don't want, still it will occur. So that is called as the conjunct movement, associated movement. They definitely occur together. The second one will be adjunct. Adjunct is easy. It is just the independent. Independent was Independence Day, so I wrote it like independent. Right? That is independent movement. Independent movement. So that was in brief. Let's start with the classification. In classification, we start with functional, which is definitely associated with the mobility. Right. So first type of joint which is not movable, we call it synarthrosis. Synarthrosis. That means there won't be any movement. It is a joint, right? Why joint? Because two bones are meeting. Two bones are meeting, so we call it joint. But there is no movement. Say for example, sutures, right? And in sutures, they are like fibrous type of joint, right? Sutures. They are called as the synarthrosis. There are various type of sutures, but we discussed that thing in the last lecture. Moving on to the second one, which is when there is slight movement, there is some movement, they are called as amphiarthrosis, right? Amphiarthrosis. Best example, intervertebral discs. Right? They are the secondary cartilaginous joint. So these intervertebral discs, the disc between two vertebrae. And the third one, freely movable. So they are called as the diarthrosis, and this is where the ligaments will be associated. And they are best example synovial joints because their function, prime function is the support and the movement. Right? So in synovial joint, where there is movement, we would like to see that in which axis is it moving. So one would be the angular axis, right? So it is like axis which is passing at an angle, right? So whether there is flexion or extension. So this is one angle. Rotary. Rotary means when it is rotating like this, right? So that means that axis is passing through long axis. It is passing like this from the top, and that's how the bone is moving. So for example, in shoulder, when you do like this, right? So that is the rotational movement. Or the circumduction, the balling, the full hand movement, that is the circumduction. So these are where the rotary movements are occurring. But then very interesting, this third one, which is called as the gliding movement, right? For the gliding movement in last lecture, someone from last batch, they said that what we drew that entire cartoon. This is BK, that is the Boni Kapoor, but we changed the spelling to BONY, right? So that is in that cartoon, everything has been marked, right? I saw your notes also, right? Very nicely prepared. That was like a homework to prepare your brain maps for the classification. Okay. Regional skull, vertebra, and limbs. Skull, they are immobile. Vertebra, there is slight movement, and limbs, they are freely mobile. Whether it is upper limb or lower limb, but it is more mobile. Upper limb more mobile as compared to the lower limb, right? Because in lower limb there is stability also which is needed. And then as per number of bones, when there is There are just two bones, we call it a simple joint. When there are more than two bones, say for example wrist, so we call it compound joint. And the complex joint is because in this particular type of joint there is intra means inside, so there is a joint inside, there is articular disc. So that's why this is intra-articular disc and TM joint, right? Temporomandibular joint is that type of joint. It is that type of joint which is a complex joint. So you asked, there were few emails regarding understanding of the complex joint. I have not replied to all those emails, right? Don't worry, you will get that reply today, right? By the time when we'll finish TM joint, you'll be having complete clarity about intra-articular disc kya hai. All the questions that won't it interrupt or won't it interfere, not interrupt, won't it interfere with the movement, etc. आज देख लीजिए, right? So you'll be having complete clarity. Regarding this simple joint, say for example, these are phalanges, right? Only these are the phalanges. So this is the distal phalanx, this is the distal phalanx, this is the proximal phalanx, and this one is the middle phalanx or the intermediate phalanx. So phalangeal joint, right? Interphalangeal means between two phalanx. So this is one, this is two, right? But दोनों का नाम same, phalangeal, interphalangeal joint. But one is near, one is far. So that's why we call it distal interphalangeal joint. And this one is called as the proximal interphalangeal joint. So from this point, we now start with TM joint, orthotemporomandibular. Temporo, the temple bone, right? Mandible is mandible. So temporomandibular joint. A rough figure. When we'll take the mandible, right? The mandible would be like this, and then there would be various teeth all the way. But this is a side view, right? This is a side view. You'll be watching that there'll be two processes. Processes means the bone is there and then there are two projections, right? So one, what is called as the condylar process, and second one, which is called as the coronoid process. Remember the shape of the coronoid, right? Triangular. Condyle is always round, right? So this is round. This is round. It is this condylar which will be used for articulation, right? This is the condyle. So when you touch over here, right, and you move, you'll feel some round thing is moving. It is condylar process, right? So then what about, now guess if it is here, the mandible is becoming like this, right? So over here, where is the coronoid process, right? Try to feel the coronoid process. So this coronoid process has to be in front of condyle. So move and then आगे जाओ, but ज़्यादा feel नहीं हो रहा, right? The reason behind it is deep. Not only that, a strong muscle is attached. So this is the surface which is for the muscle attachment. But अपने गाल पे हाथ रख के, right? Close your mouth and chew. You feel something, right? These are all the buccinator muscles which are meant for the powerful chewing, right? So that's why those West Indians, etc., right? Chewing gum चबाते चबाते मतलब खेल रहे हैं. So you'll find that their jaws are very prominent, right? Recently, I saw the difference between lion and tiger. The bite of the tiger is 1,200 pounds capacity. 1,200 pounds. That means when they chew, it is this power, right? Lion is 1,000 pounds, right? सबसे खतरनाक वो छोटा सा कछुआ, right? When it comes and bites, 4,000 pound pressure. So that's why that छोटा कछुआ, right? They can break the bone, they can crush the bone. Right? Crocodile, so don't ask. Whales, so they are in thousands and thousands. They are that powerful, right? So this is the thing.
Hyenas have very high biting power.
Yes. Very true. Very true. Rhinos. सांप जो है ना, सांप के अंदर whenever if there is any snake bite, never panic. the snake bite would look like this, right?
The
Because snake
panicking would increase the blood
comes,
flow.
so the snake bites like this. All you have to watch is, apart from those teeth mark, is there anything like this? If yes, so that means it's a poisonous snake, because the fangs through which it will be injecting the venom, right, they are inside. So when the cobra, right, or the viper, Russell viper, when they bite, so they bite like this. So those teeth, I mean, yes, there would be injury, right? दांत से किसी ने काट लिया तो that there would be injury. It is a physical injury. Nothing can happen. Nothing can happen. But those two fangs, when they are injected, right, and through that it will be injecting the venom into the blood. Now, world's most dangerous snake is not cobra. The world's most dangerous snake is mamba.
Black Mamba.
Black. Very dangerous. And then when we were in Africa, so we saw black mamba and the green mamba, both of them. And it is like cobra is someone, if you don't disturb him, they won't do anything. It is exactly like lion. You don't disturb the lion, and if you see that their belly is full, खा पी के बैठे हैं, you take the photograph from the distance of 10 feet. They won't mind, right? Just सर उठा के देखेंगे, and then once again they'll go to sleep. You can't have that thing with cheetah. You can't have that thing with tiger, right? Because they are ferocious. Exactly the same way, mambas, right? Mambas, they attack. They see and then they attack. And there is one reported incidence, right? It is a reported incident in Africa. Mara River, it was there. And then they used to cut those big blocks of trees, right? So this was a long bullock cart. There were 32. It was a row of 16. Was total 32 ox, right? Bell. Okay. And here was the person. And here there was one person. Mamba came from the river, thak, 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 and went into the jungle. The bite was to 16 ox and 2 persons. Out of this person died, 12 ox died, and last 3, 4 only they suffered. This is the danger. This is the dangerous thing, because mamba, cobra, it bites this and the entire venom is injected. Khatam. And after that, if it is biting anyone, nothing can happen. In case of mamba, they inject the venom slightly, but that venom is so powerful that it is sufficient to kill the person. So this is a recorded case, right? Very dangerous. Okay, so coming back to our topic. So this is the muscle attachment, strong surface for the muscle attachment. This gives this area, strong surface for the muscle attachment. So here, this is external auditory meatus, right? And in front there is TM joint, and over here there would be a powerful buccinator muscle. I mean, when we'll be discussing face, there are several muscles. We'll be discussing all of them. But this is the muscle which is for the powerful chewing. Similarly, there is temporalis muscle also, right? All of them, they'll be getting the attachment from this coronoid process. Now, as you go back, right, behind the ear, you find a very prominent, and that is the mastoid process, right? Mastoid process. You asked about to talk something more about the mastoid process. One of the important thing for mastoid process is that inside there are spaces. There are spaces to make the skull light. It looks so tough when you touch it behind the ear, but there are spaces, and in those spaces, infection can occur. Infection can occur, and it can lead to pus, and that pus can travel inside, right? Even behind it, on deep inside, there is a styloid process. So just behind and deep, but it is very difficult to feel. Unnecessary, you will be hurting yourself, and that is the styloid process. Because in styloid process, again, it is a bony prominence for multiple muscle attachments, right? It would be absolutely a pleasure when you'll be discussing about all the muscles which are attached with the styloid process. So here is our dissection. This is one joint which has been completely opened. Our principal, when will be discussing the the discussion, it will be like first come across something which is easily known to us. So here it is. This is known to us, correct? External auditory meatus. Just in front of external auditory meatus, this is the joint, right? This is a joint. And as we said that this joint is formed by the mandible and the temporal bone. So this is the temporal bone, right? Temporal bone. As this temporal bone is going in front, right? It is going in front. You can watch a suture over here. Just change the pen. You can watch the suture over here, right? This bone is zygomatic bone, right? This one, right? Your cheek prominence there because of the zygomatic bone. So that zygomatic bone is going back, and piche se, this temporal bone is coming like this. This is the point where they both meet. So this is temporalo-zygomatic suture, right? This is the suture. Can you see it? Or should I?
Yes.
You can see
Yes,
it.
sir.
All right, right? So, boli. Okay. So this
Is
is
the suture?
suture. Suture means it is a joint between two bones. A very faint thing is seen, right? Very faint. You have to focus on it. Now can you see? But slight darkish lines like this.
Yes, sir, it's visible.
Ha. So that is the between temporal and zygomatic. So when the name is to be given, so this bone is temporal bone. Temporal bone. So this is a process. Process means it is extending. So we'll say that this is the zygomatic process of temporal bone. Got the idea? Right? Because this
Yes,
process
sir.
is extending and it is meeting the zygomatic bone. So similarly, there would be a big one right over here. There'll be the zygomatic bone, and from zygomatic bone again there is something which is protruding like this. So bone is zygomatic, but the process would be temporal. So it will be called as the temporal process. Temporal process of zygomatic bone. Make sense?
Yes.
So easy. This is how the nomenclatures will be going in head and neck. People find that it is confusing. No, it is not confusing because some things, some information, they are hidden in the name itself. So it becomes very easy. Something which is mentioned like superior, inferior, middle, that means we know that these are at various levels. So over here, this is the condylar process which will be forming the TM joint, right? This is the TM joint, temporomandibular joint. Okay? And then this is the whole mandible. And here it is going above. And we now see, yes, in this muscles have been, skin has been removed, fascia removed, muscles removed, and we are watching straight away the ligaments and the cartilages, right? So here it is. This is a separate mandible to show the condylar process. Here is the condylar process. This one, right? That's the condylar process. I remove this. See the surface. This is into its anatomical position. That means even when you are standing, the jaw, so then this is like a gliding surface. Gliding surface. It is going down, right? So this is the gliding surface which is giving our aspect, which is affecting range of motions. When it comes to Python, they do also have this TM joint, but our TM joint is like the bone which is above and then the whole fibrous capsule, right? In them, there is fibrous capsule, there is synovial joint, but then they are connected with ligaments. So actually, the mandible, it can extend and they can gulp a bigger structure, right? Over here, when we eat pani puri, so then it goes to the extent, right? Pura mukh khula hai, but then that's it, right? We can just have that pani puri. We cannot have that big puri. We cannot put the big kachori directly. For Python, to eat the entire kachori is easy, right? Not easy for us because for them there is elastic bandage. So that band, it takes the mandible away, and thus they can eat big. Right? So this is the gliding surface. Watch here. Now in this case, we have once again put everything back. So over here, we have just removed the skin and the muscles. Bas, baki sab kuch intact hai. So fibrous capsule and everything is lying over there, right? So here is fibrous capsule is here. This part is removed. This small part is removed. This part is removed. So just to show the articular surface, right? Articular part, this one. So that articular part, it is because mandible will be fixing in it. So this is called as mandibular fossa. Here it is now. Now see, I removed all these lines. Yes. Now we have put everything back, right? Everything back. Over here, this is the mandible, all right? This is the mandible. Just remove this. And that's the external acoustic meatus. And this is the joint. See how it looks like, right? Everything is hidden inside this. This is the joint which we are talking about. And this entire enclosure is the fibrous capsule. Fibrous capsule. Because this is a synovial joint. So there'll be fluid inside, there'll be disc inside, and then everything is packed. Things to see in this, it is this lateral ligament. Never miss this ligament. This is seen so beautifully in this. I'll just outline it first and then you try to see it after removal of those lines. See this portion. I'm talking about this portion. This portion. This is the ligament. Right? I'll just zoom it and then I'll remove these lines. Can you see the structure? That this is a bone which is white. And then there is some structure which is going like this, and it is going like this. Right? What?
Yes.
This is lateral ligament. Right? Very
Okay.
importantly. So that is the lateral ligament. This one. Now we have removed the fibrous capsule. So you can think it like over here, we put a cut. We create a window. So that's the fibrous capsule cut. So the entire joint is intact. Over here, the fibrous capsule is there. This lateral ligament is also there, but we created a small window. Right? The window which is exactly over this condylar process. This is the condylar process. Correct? Condyle. This one, round one. And this one is the temporal bone. This is the condyle of this mandible. See the disc which is in between. That's the intra-articular disc. Right? This is the intra-articular disc. So graphically, when we say, so above we have got the temporal bone, below we have got the mandible, and in between our disc is there. Because this disc is inside the joint, so that's why we are using the word intra. Right? Articular means articulation, that means joint. Right? So this is a disc which is inside the joint. Let's take the disc apart. So here we removed everything and the disc has been taken out. This is how it really looks like from the side. This is a side view. Interestingly, when we watch it from the top view, it reveals that we have got a big surface, right? This is pretty flexible, but very tough, right? Because it will be bearing the pressure of two bones. So this is very flexible and tough, and that's a top view. This is how this disc would really look like. Putting things back, these are just the bones. Our focus is now see, now you'll be able to identify so many structures. Here is the zygomatic bone, right? Then this is the temporal bone, and these are the arches. This is external auditory meatus. This is the mastoid process. This is the styloid process, right? You can identify all of them. We focus on this area, and all you have to watch is this and this. Watch the distance, this distance. I'll mark it with red. This distance. This is what is called as the hinge movement. So when you open your jaw and close your jaw, right? Where is it occurring? We'll just talk about it. But these are the two movements. One is the hinge movement. So when you ah, band, ah, band, right? So that is open and close hinge movement. Here it is directionally. Jaw down, jaw up. This is another movement, which is the gliding movement. The jaw is protruding and then it is going back, protruding and going back. So this is protrusion of jaw and the retraction of jaw, right? And when you do it, obviously the jaw is going forward, so this distance is going to increase. This distance, है ना? सीधी सी बात. Because if you take the whole neck in front, that is not protrusion of the jaw. Only the jaw is going further, right? So that is called as the sliding movement. TM joint is that type of joint in which there will be two types of movements. Now let's see this. This is a concept. ये concept कभी मत भूलना. Questions they are asked from this such type of say concepts. T is temporal bone. Correct. 2 is what? 2 is that our disc, right? Intraarticular disc. And 3 is what? 3 is the mandible. So thus we have got three structures. Structure 1, structure 2, structure 3, right? So there will be like upper chamber and there will be lower chamber, right? So to ease the, we can write it over here. So this is the lower chamber. The hinge type of movement is occurring between, the hinge type of movement is occurring in lower chamber. And when we watch this, the gliding type of movement is happening in upper chamber. So upper chamber is this, then the disc. So this is where the upper chamber is there, and this is where the gliding type of movement is going to occur. Right? We have to remember it. The easy method to remember is gliding type of movement is occurring in upper chamber. So if you see when you write G, so we write like G. U to U, that means all curves, curved movement. Hinge type of movement is occurring in lower. So here everything is in the form of line. If you want to write H, so it is like that. L, so it is like that. CD line, right? When we write like this, right? When we write like this, that visual impression will help you a lot during your revision. And now if that MCQ comes, that gliding type of movement occurs between, immediately you see gliding means upper chamber. Upper chamber means it is between temporal bone and the disc. No way you will be making a mistake of putting it over here, right? You are very crystal clear. So this is how it works. Let's move on to the X-rays.
Sir,
Bol.
could you repeat the C, G, U, and H? I couldn't understand what you were trying to say.
See, when we write G, so then it is like curves, na?
Yeah,
Curves. When you write U, so your pen is moving in curves.
right.
When you write H, so then it is tuck, straight lines. When you write L, so this, straight lines.
Okay,
So
okay.
this is like when it comes to hinge movement, it is in lower chamber. When it is gliding movement, it is in upper chamber. But ek bar,
Okay,
once it is set in your mind that okay, which chamber, so then you are smart enough to figure out that between which contents.
okay, sir. Got it. Thank
All.
you.
Now move on to the X-rays.
Sir,
Huh?
sir, hinge movement occurs between disc and mandible, right?
See, right? Lower chamber now. So this is disc, right? This is the disc, and this is mandible. So that is the hinge movement. Right? So when you just chew, right, up, down, so that is the lower chamber which is working. But when you protrude your jaw, that is the upper chamber. ठीक है?
Okay.
All right, sure. So this is X-ray knee joint. Let me remove some marks. So here is the standard knee joint, right? In which we do watch femur. So that's the femur, then tibia and the fibula, big bones. So not a big deal. What you have to watch is, this is patella, the kneecap. Can you appreciate it?
Yes.
Right?
Yes.
There is clear, distinct image of the patella. And do you really see this prominence? And then it looks like this prominence.
Yes.
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 Yes, sir. Yes, sir.
So they are condyles. So when we'll see the bone now, so then the bone, the lower end of the bone, the lower end of the femur, that is like this big rounded condyles, big structure, because they'll be transmitting the entire weight on the tibia, right? So they are making the knee joint. So they are called as the condyle. These are called as the condyle. Now, whether this is medial condyle or this is lateral condyle, how do we know? From the direction of tibia, right? And we know that tibia is medial, right? Tibia is medial. So this is like medial condyle, and this one would be the lateral condyle. So far, so good. So we know now where is patella. We know medial and lateral condyle. We know that this is the lower end of the femur, and that is what is forming the knee joint coming to this tibia. In tibia, it is like, see how beautifully they both are parallel, right? Same, we can see a clear space between both of them. Life is good, right? And in this, we see some prominences. So that is called as the tibial spine. Tibial spine. So we have got 1 and 2. 2 depressions, that's where the meniscus, the cartilage will be going and sitting, right? So, but the cartilage is a soft tissue. We can't see really so clearly onto the X-rays, right? We can't see. So that's why we'll be watching it like a gap. So this is the gap which we are talking about, because if the cartilage is, those menisci, they are torn or they become thin, so this space would decrease, right? This is uniform space which is between femur and the tibia. So we would write it like femorotibial space is normal, right? So that is normal. And this one is fibula, right? That is obvious. Just do remember, this is called as the tibial spine. These are the spines. These are the very sharp projections which are coming out from the tibia, and they are over there. Function, enormous function. The side view. Inside view, no marks for telling that this is femur, obviously, right? This is tibia, that is fibula. Fibula is where? Here it is, overlapping, right? Now try to see that. Now it is clear that this is fibula. In X-rays, many times it happens like सामने चीज है दिखती नहीं है. Right? So over here, this is how the fibula is. Things to be seen is, this is patella, right? And then over here, there is something which is engulfing it like this. That's quadriceps tendon. Quad means 4. Ceps means head. That means there are 4 heads. So there'll be 4 muscles. The muscles, 3 muscles, they are rectus, right? So 3 muscles which are vastus. So vastus means big. Vastus medialis. So it will be on the medial side. Vastus lateralis, so it will be on the lateral side, and vastus intermedius, which is between both of them, right? Intermedius or the intermediate, right? In between. So these are the 3 muscles, plus there would be 1 muscle which will be going straight away that would be the rectus femoris. Rectus means straight, femoris means thigh. So these are the four muscles. Four muscles, so that's why we call it quad. Quadriceps tendon, all these four muscles combine and then they move towards, they get attached to the knee joint, right? So it goes all the way, and it actually lands over here. You can see the landing. It actually lands over there. So in between, patella बीच में आ गया, तो patella is wrapped up under ले लिया, right? So that's why this is a bone which is developing into the tendon, and such bones they are called as the sesamoid bone. Sesamoid means seed-like, seed-like. Right. So that bone is called as the sesamoid bone. Patella is the largest sesamoid bone. In upper limb, there would be fibula. Right? There are a few other bones also, but this is the patella, largest sesamoid bone. Sesamoid means seed. Seed means it develops in the tendon. Right? What would be its function? It acts as a lever. It acts as a pulley. Right? So it has got the lever function. So when it is the purpose to change the direction of muscle action. Right? So if this is the knee, that muscle is connected over here. When it pulls this, right, it would be lifted. The knee would be lifted. So that's how its function is. Now see this. This is a known case of osteoarthritis. I'm first removing all the markings. We remove this mark also. We remove this mark also. So here it is. The first look. Compare with this and this. Is it difficult to say that there is decrease in the disc space, decrease in the space between femur and tibia? No, not at all.
No.
दिखने पे एक
No,
second
sir.
में पता चलता है. So that is the first thing which you will watch. But even before that, do you find that bone is a bit deformed? यहाँ पे कितना बढ़िया, look at the super fine margins. Condyles, exactly.
Yes, sir.
Condyles. Right? So graceful, beautiful curves. Right? Absolutely fine. Think about this. कैसे है? As if it is eaten. And see the bone. ये इतनी prominence, and then यहाँ पे कुछ हुआ. यहाँ पे भी there is something wrong. यहाँ पे तो definitely it is wrong. Here it is okay. So we saw that one, there is decrease in the joint space. Decrease in the joint space, the space between femur and tibia. That space is decreased. And the second thing which we saw, that is the osteophytes. These are called as the osteophytes. These are also osteophytes. The third which we see is tibial spiking. So as if this tibia is almost entering into the femur. Right? This is what is called as the tibial spiking. Tibial spiking. It spikes into the other bone. Reason behind it is very simple. The disc space has decreased, right? The space which is between femur and tibia, that is decreased. So that's why everything is coming near. So basically it is one and the same thing. And the next thing which you'll watch is the margins. Irregular margins. Because now there is inflammation has set. So that's why it is called as the osteoarthritis. It is a degenerative disease.
Sir,
Uh,
so due to the tibial spine, it is entering inside the femur. Is there any pain noticed in the patient?
very much painful. This is very painful.
And due to the what you said, like
Osteoarthritis.
yeah, that projection, round projection in the left side, due to which some pain is noticed.
Osteophytes, because of osteophytes,
Yes, sir. Yes, sir.
it is very painful. It is painful.
Okay, ma'am. Okay, sir.
Right? On to the next one. Sometimes it is asked that this is right side or left side. This is right side.
Left.
Left.
Just you have to just figure out which side is medial lateral, because this is femur, this is tibia, so this is medial, this is lateral, and it's as if patient is standing in front of you. So patient is standing in front of us, so this would be the left side, right? It would be the left side. That's right. Now in this X-ray, what do we see? See the difference. See this narrowing to what extent? Extensive, right? Almost there is no space between femur and tibia. Very painful. And see the ends. They are not gracefully smooth. No, they are like this. Over here also, condyle is not absolutely smooth. No, there are some extra projections, rough area. So these are what call as the osteophytes. Fibula is lateral, you know that part.
Sir,
Hmm?
in the above screen, due to there is space, is there any pain noticed in the patient? This screen, sir.
This space,
Due to which pain happens?
a patient won't be able to operate. See, pain always occurs when the periosteum strikes with the periosteum, because periosteum is having nerve supply. Correct? Periosteum has got nerve supply, so that's why this would be painful. Cartilages, they don't have any nerve supply, so they are not painful. Fibrous capsule, it has got stretch receptors. So when there is inflammation, so yes, there will be generalized pain. पूरा knee joint pain, पूरा घुटना दर्द होगा. Right? जब वो ऐसे पूरा पकड़ के बैठते हैं पाँव के, पूरा दर्द हो रहा है. It is because of that. Fibrous capsule is getting stretched. Right? But why over here? So this pain is so unbearable. It is like patient won't be able to even move their legs. और जब देखो तो दो में से एक पाँव में, when there is more pressure, so person would not like to put more pressure on this. So that's why झुक के चलेंगे. Right? They would be putting extra pressure only on that leg, which is fine. So they will be putting pressure on the leg which is in trouble. So जहाँ पे भी झुक रहे हैं, that is normal side, opposite side is abnormal. So that's how you judge even when the patient is walking. So are they arthritis? In the morning, when many of the people, they walk like this, right? Walk like this. And wide stance. Wide stance because hips are adjusting the pain of knee. So even though they have come to, they are walking like hathi, right? Because they are adjusting it. So they are like known cases of osteoarthritis. Yeah, yes. Achha. Then don't miss these osteophytes, right? You can see the osteophytes. Osteophytes are extra growth. So this is not a graceful turn. This is how this prominence. That is called as the osteophyte. Here it is, the big osteophyte. The bone is overlapping, right? See, there is a light shadow and then there is a dark shadow. So this bone is overlapping, but as such, this one is a big osteophyte. Fibula is later. Here it is your MRI. Right now, because you have already discussed the MRI, and even if I just show you one plate, you'll be able to see it without any problem. That this is the disc protrusion. This one is our spinal cord, right? That's the spinal cord. And these are the vertebras. These are the vertebras. These are intervertebral disc, and as such, discs all seem normal, but there is protrusion over here. And that is protrusion, right? That is protrusion of disc or the intervertebral disc prolapse. It's called as intervertebral disc prolapse. And technically speaking, which part is coming out? It is the nucleus pulposus. It is that nucleus pulposus which is protruding, and that is what we really see. See over here, this is one more. This is the hip joint. Let's remove all those arrows. Right. See, we have discussed this case, so that's why it is so many messages. Let me take them very quickly. Okay, you did the homework. Very good. Good morning. That we are doing. When will be the next test? Test na? Abja pull, we'll keep it. So we can do left and right movement like chewing like a cow. Ball and socket, those ball and socket kaisa hai? When there is complete count, right? And then there is only one movement. There is, you won't be able to move. Just the ball is moving onto that socket, right? Whatever the ball movement is permitted, accordingly it is happening. Literally जो गाय जिस तरह खाती है मतलब side to side, when you try to do that you'll find it difficult. You won't be able to do that thing as effectively, right? For one person we won't be able to change time and date. That would be difficult. We can't do that. For USMLE, it is like once you complete your USMLE, okay, this is like once you complete your USMLE, you do your super specialty over there, and then if you wish, I want to go back to my country, or you want to come to India and practice, you can. Beyond doubt, you can. Because USMLE and those degrees, they are definitely valid over here. I think this was discussed many a times. Yes, but it is valid. It is valid. Yesterday only the result came for this FMG exam. Dhruvi, it is bit early to start for USMLE. For at least 6 months, just understand, because you will be appearing for step 1 USMLE by the end of your second MBBS. When the second MBBS is complete, and that second MBBS, which should be completing your patho and pharmac, 2 mammoth subjects, huge one, right? And physiology. Physiology combined, physiology, pathology, and pharmacology, they are comprising of more than 50% of step 1. More than 50%, right? So yes, you can
You
start.
get it in the third year, right?
So after completion of 2 years, right? And then these subjects should have, but in foreign universities, many times pathology is rolling into the third year. Actually, in India, this is how it works. First year, anatomy, physiology, biochemistry, finished, done, right? Nothing rolls on to the second year. Second year, it is patho, pharmac, right? And then other things like say forensic medicine and microbiology, etc. But patho, pharmac, 100% khatam, second year, right? And then starts the third year, in which the major thing would be surgery, medicine, and gynae, right? These will be the main. Regarding all other things, pediatrics, ENT, ophthalmology, radiology, dermatology, they go side by side. Radiology is like, it will be with surgery, it will be with medicine, it will be with gynec, it will be with patho. It is with everyone, right? But when you'll be going for rotations, they start from second year onwards. So there will be rotation for 2 months into pediatrics. So you are going over there. Meantime, some other of your friend from the same batch, he or she might be going into ENT. So that rotation, it keeps on occurring. The list is given right in the beginning. The entire schedule is fixed, right? So that's how it goes. And the moment you start going into clinics, immediately you'll realize कि yes, X-ray chest तो मतलब दिन के आप 100 देखेंगे. It's that frequent. It's every time anything is there, and when the rotation is in medicine, right, and that also into your pulmonology department, pulmo or cardio. For every patient there will be X-ray chest. Every patient, right? देखते देखते थक जाओ. So in one rotation, you end up in watching 1,000 X-rays. So that's the system. But yes, in abroad, I heard that even in the second year, anatomy is getting studied. Even in the third year, they have not finished the pathology. This was the purpose for those private tuitions. So in which, say, I'll be giving you the schedule, but it happens like it will be definitely the extra burden on you. So I don't right now, why I'm not telling you is because that would be like a torture chamber, right? You'll actually be feeling like that it is like a parallel medical college. But then in that college, that is when you'll be studying with me, you have to give time and you have to literally दिन रात भूल के काम करना हो तो ही. Because right now it is so convenient. मतलब अपना revision तो आप 1 घंटे में revision खत्म कर सकते हैं. But over there, if I'm teaching you for 3 hours, you have to give another 3 hours for that revision. Only thing which I'll promise you is that at no point of time it would be said like that, chalo, फटाफट PowerPoint की slide बना दिए and now you finish rest of the things by yourself. Never ever, never. Even if it is a small topic, smallest of the topic, it is taught. रात को 2 बजे होगा तो 2 बजे, but it will be. So that is where you start getting the heat that how these Indian colleges, I mean, you are also Indian students, so I won't be using the word Indian students, but how the training, the medical education, it goes into this BJ Medical College, right? Where we used to say कि martial law लगा के रखा है, but we found that importance of that when the moment we came in the second year, the moment clinic started and we said कि यार कितना comfortable है, right? You are so happy.
सर मग ते 40च्या खाली नंबर गेल्यावर मी बंद करतो.
अरे साई शांत. Okay, so here it is. Now the hip joint. So in hip joint, this is the hip bone. You know that, correct? And that's the acetabular cavity. And this is the head of femur. And head of femur is so smooth, round, perfect. And over here, it looks like as if it is having several cavities, right? It looks damaged. Yes, it is damaged, right? And you know the reason. This is when the nutrient artery, which was coming over here, that nutrient artery is damaged. And because that nutrient artery supplies the blood to the head of the femur. So that has gone. So that's why head is going into necrosis. It is getting totally
Necrosis.
avascular necrosis. Very true. That is what is called as the avascular necrosis. A means without. Right? A means without. So without vessel means blood. So there is no blood. So that's why necrosis matlab sad jana. Right? Say once you clear USMLE, you don't have to appear for any of the exam in India. Whether tab next ho ya koi bhi exam ho. No. USMLE is respected in India, so you'll be able to practice. Yes, if it is. Cartilage bhi damage hoti hai na. Bilkul damage hoti hai. FMG or next is that is you'll be appearing for those exams after completion of your final MBBS. जब आपने जिस भी country में से कर रहे हैं खत्म किया, you are coming back. तो FMG is called as Foreign Medical Graduate Examination जो अभी चल रही है. Right now it is in that. By the time when you will be completing your MBBS, it will be next National Exit Test. It will be National Exit Test. Okay, I'll explain. Just 2 minutes. So this is what is called as the avascular necrosis. In avascular necrosis, there is something what is called as the Ficat staging. Ficat staging, in which you need to watch the CT scan, but in general, it is divided into 4 parts, 1, 2, 3, 4. So stage 1, stage 2, stage 3, and stage 4. We evaluate that thing from the CT scan, right? From the CT scan about how much is the damage. So if it is stage 1 and stage 2, then you go for that patient the conservative treatment. Conservative treatment means you are not telling that, okay, go for the hip replacement. When it is stage 3 and stage 4, so then surgery is the only method. Surgical treatment is the only method. And in that method, it is THR, total hip replacement. That means this entire thing, it is made up of, it is called as the prosthesis. जहां पे भी वर्ड प्रोस्थेसिस आए दैट मीन समझ लो इट इज द आर्टिफिशियल एलिमेंट. So when it is like, say, auditory processes, right? So those Millisinca steps, they are now artificial bones, right? So there is, all those are removed and that new structure is kept, correct? Total hip replacement, total knee replacement, those things, they do occur. One of the question which was asked for the cracking of joints, cut, right? So it has got nothing to do with arthritis. This is one clarification. It has got nothing to do with arthritis, right? When that joint speaks, when they make sound, right? So it is that cartilage is, either it can happen, because if you have to ask for this, whether there is any pain or swelling. If there is no pain or swelling, so it is just when the cartilage is moving, or when the bone, when the ligaments, they are snapping, right? So in someone like this and this, right? In martial art movies, they do that, right? So if the cartilage is eroded, then there will be continuous sound. Every time when you move, right? When you move your neck, if you find that some sound is coming, so it could be, so that is called as the crepitus. The crepitus is heard not necessarily that when someone is injured only. Even the muscle movement, when the muscles are moving, right? When the tendons, they are snapping, right? And snapping is acid, right? So that is snapping. So it can produce the sound, or if the damage is extensive. But say for example, कोई सीढ़ियां चढ़ रहा है, right? So when every time char, right? If that type of sound is coming, so remember, it is when the cartilage is damaged. This was something which I read last year. Previously, it was said that yes, this is the synovial membrane, right? There is a synovial fluid. In synovial fluid, there is oxygen, nitrogen, carbon dioxide, all those gases are produced. So and they are produced in the form of small bubbles. So when the joints move, those bubbles break, and that is what is leading to these type of joint sounds, or the cracking of the joint. But then came the real-time MRI. In real-time MRI, it was shown that it is not because of the breaking of those bubbles. It is because the creation of cavity. That means the bubble put, right? I say the bubble bana. So it would create that cavity. It would push the fluid. That pushing of the fluid, or the creation of cavity in the synovial fluid, what is causing the crackling. And they gave the word tribonucleation. So this is the word tribonucleation. That is because of the real-time MRI. That is when the person is moving the limb and the MRI is scanning at a high pace every section, right? This requires special machine, but that is what it was shown. It is called as the tribonucleation. So some things which were asked in last batch, that what to do. One is mindfulness. Mindfulness is unnecessary. Don't keep on tuck, right? Don't keep on damaging those. Then second is move more. This is as such universally important. Move more than 45 minutes. So don't stay in one position. Just you can move slightly, or you can just have a walk of 5 steps, 10 steps, but at least that will keep your joints very good. Stretching, suppose nahi hua. Say class hai, we are sitting since almost 1 hour 15 minutes. Koi baat nahi. As soon as the class is complete, right, we start with the, right, finish the stretching part. Stretch your upper body, lower body, right? Some stretches. So that is important. Then whenever there is stress, this deep breathing. In deep breathing, my favorite, always do this. It is called as the box breathing. Box breathing. Jada nahi. 5 times. What is box breathing? Ye box banaya. Right? Breathe in for the count of. This is a box of, let's say, 4. So count of 4. 1, 2, 3, 4. Breathe in. Hold. For the count of 4. 1, 2, 3, 4. Breathe out to the count of 1, 2, 3, 4. And hold. to the count of 1, 2, 3, 4. So every time it would be 1, 2, 3, 4. Hold. In. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Out. 1, 2, 3, 4. This is called as box breathing. As your efficiency increases, move from 4 to 5. Right? When do we say efficiency is good? When you can handle all the 4 things. That is, even after full exhalation, breathe out, still you can hold it to those many seconds. Right? Then you go to 5, 6, 7, 8. When you reach up to 8, right, give yourself shabashi, because that is really good. So this is what is called as the deep breathing. And second is always write, make a diary. Right? In that diary, write down everything, all your frustration and everything. You can keep it digital. I don't know how many of you are still writing. This was said way back, right, when we started. But consistency is important. Right? Who is writing still, who has not missed the day and still writing consistently? Good, good. Abhijit, Sania, Tanvi, Kushmin, Pritam, very good, very good. Kulshri, Kunjal, nice, nice, nice. Nitra, Asya, okay, very nice, very nice. And you would agree to that by the end, right? Diary एक बार लिख ली, right? Diary means रात को सोने से पहले you write something. Also write one more thing. What I'll do tomorrow. Write down that also. You'll find that next day you are with a focus. कि आज इतना काम करना है. Even if it is छोटा सा काम. But yes, you write it down, you'll be doing it effectively. Right? And then exercise. For the exercise, for the lower joints, usually these cracklings that occurs in the lower joint. So for lower joint, especially for the foot, this is one of my favorite exercise. Stand on one foot and go for A to Z. A to Z, right? So with your foot, as if with your toe, a chalk is attached on the toe, write A, then write B, then write C. That way reach from A to Z. Your toes, you will never be getting pain into your those arches, right? पाँव में दर्द हो रहा है, पाँव में जलन हो रही है, all those things, nothing, right? You'll be absolutely fine. और ये करने में, you can do it fast, right? Maximum 3 minutes लगते, maximum. This I'm writing max. बाकी 3 minutes नहीं लगते. Within 1 minute you can finish it, because if you write A 1 second, right? So 26 alphabets, 30, 40, 50 seconds. 2 minutes में तो खत्म हो ही जाता. दोनों पाँव. You have to do it once. Very effective. So, all right. So that's it for today.
Answer for shoulder.
For shoulder, the best exercise is roll front, roll back. And then there is one very typical exercise, right? When you'll do it, you'll find, or you can do it even right now. Hold it like this, right? And then drop the hand, right? Do this. You'll find a severe burning pain into the tip of the shoulder, right? Full 90 degrees.
Sir, how do you avoid shoulder injuries? Because shoulder is the it's used the most when you work out.
Yeah. As such, we'll talk about more when we'll be discussing the rotator cuff muscles. There are 4 muscles, right? You need to make those muscles strong. So if those 4 muscles are strong, there won't be any injury to the shoulder, because they make rotator cuff, SITS, supraspinatus, infraspinatus. But the thing is, even at this point, to make the shoulder strong, three exercises they are considered as extremely good and powerful for shoulder. One, take the dumbbells, and those dumbbells which you are comfortable with, right? This is for male as well as female, because this will be giving a very graceful curve onto your shoulders, right? So here you'll be holding those bottles and then take it on the top and then come back. The idea is this is not the exercise. You take it to the top and then right, you are falling. No, go slow, go fast and come back slow. go fast and come back slow. It means you are defying the gravity. So even if it is just 2 kilogram of dumbbells, you do this exercise for just 20 times and you'll feel कि हाँ हाथ में कुछ हुआ, right? So this is what is called as the overhead press. But up, fast, down, slow. Because as such, gravity is pulling. You just slow it down. So that is where your extensor and the flexor, both of them, they are working. So this is one exercise. Second, very deshi exercise, but super powerful. Hold the dumbbells and this is right in the akhada, you know, that is called as the magdal. वो बुडन आता है, it is of this shape. And you hold it and then you do it, right? और कुछ ना, पानी की bottle लेके, that can also be done. But this is like, let's write desi. ठीक है? There is no other name. So when you do this is in fact a compound movement. This is a compound movement. And any compound movement, it is super effective because it will give you the strength as well as give you the endurance. And do it for more number of repetitions. Still you feel कि बस अब नहीं होगा, right? Keep doing it. And the third thing is, you do bicep curls, right? But when you combine the bicep curls with and then the lift, right? Rotate and curl. So bicep curl, right? So you curl, then rotate and then up. Rotate and then go up. So again, this is a compound movement. Because see, you are involving biceps when you are rotating, right? So you are involving brachioradialis, and then we are lifting, so you are involving the deltoids, straps, levator scapulae, all of them, right? So this is also a compound movement. You just do this thing. How many to do? First, go for whatever the weight which you decide. First, figure out what is your max reps. This is how the exercise is to be designed. Max reps means maximum reps. एक ही set करना है. Just count how many times you do that. So even if you are using 1 kilogram of dumbbell na, after doing 50, so it will weigh so much कि hoga, right? So figure out how many maximum reps you can do. Let's say maximum reps is 50. So now your next target would be 70% of it. 70%, ये उस दिन नहीं, next day, right? Or even not even next day. You have to do it 3 times a week. So next to next day. So you'll be going for 70%. That means if 50 hota tha, to 35 multiplied by 2. 2 sets. This is applicable to all of them. So first day, find out your MR, max reps. Max reps is कि जब उसके बाद, even if someone gives 10 लाख ना, तो भी नहीं, बस खत्म. When you really know, because in this way, there are 2 types of muscles, fast twitch muscles and slow twitch muscles. In your muscle fibers, there are 2 types of fibers. When you are going for max reps, you are exhausting both of them and there is zero ATP. There is no ATP. So that is when, what is your maximum strength, right? Once you know, shift down to 70%. If you find 70% is difficult, no worries, you can shift down to even 60%. So 30 kar do, 30, chalega. But then stick to it. How, when to increase? When you find that you are totally comfortable and there is strength left out even at the end of 2 sets, so then don't increase the number of sets, increase this. So instead of 30, now go for 35. When you find even this is comfortable, you move to 40. Till you reach to your MR, maximum reps. And when you reach to this level, then start increasing by not more than 5% per week. Right? If once you finish this, I'll be telling you more about this. not more than 5% per week, because we don't want with all those stretch marks, they start appearing onto your shoulders and everything. These muscles are there, but those stretch marks, they look bad, right? Why to damage the body? So give the body a chance. And whenever you are doing these exercises, obviously the protein is to be consumed. Protein. The two best sources, one, your sprouts, right? They are the very good sources. And those who are eating eggs, so yes, that is also undoubtedly the good source of protein. But anyone who is pure veg like me, so then sprouts, they are very good. Recently, I came across one sprout maker, right? 300 रुपए का आया, but a good one. कुछ नहीं है, just glass की bottle, and then there is a plastic cap with a support, angular support. So पूरा 1 किलो जितना बन जाता है sprout in just 2 days. Very wonderful. So that's it for today. And in advance, happy Independence Day. Right? Tomorrow we are not meeting, but right. So that's right. Jai Hind.
Thank you, sir.
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 Sir.
Sir,
Someone asking something?
yeah, I had a query.
बोलो ना, बोलो.
Sir, after doing PLAB, if we get the UK license by completing the PG, will that license be applicable in India too?
नहीं. PLAB जो है ना, PLAB, it is, you must have seen like MBBS, then MD, and then they write, say, MRCP, Member of Royal College of Physicians, right? This is needed. After that, you can add all those things from UK. But UK degrees, having only UK degrees, no, that you won't be allowed to do the practice over here. Right? It is the USMLE which is allowed. Maybe if you have done the post-graduation over there, right? You finish the post-graduation.
Yes, sir, that like after completing the PG.
Acha, PG, then it is a different thing. But then no one comes over here. No one comes back over here. Reason?
Sir,
There you earn in pounds, right? And over here it is in rupees. So that difference itself is 100 times.
sir,
Huh?
I have written my some questions in chat box. Please reply me.
I mean, I told you about this, na? You're talking about USMLE, na?
No. If NEET is not qualified, then am I able to do here in India?
See, if NEET PG, because now you have got admission in MBBS, so that first NEET UG is out. This is about NEET PG. NEET PG is optional. NEET PG, you will be appearing only if you want to go for post-graduation. Otherwise, you have completed your MBBS, you complete your FMGE, right? So then you are allowed to practice in India. Then whether to go for NEET PG or not, that is totally up to you. If someone tells, no, I don't want to go for post-graduation, fine, don't go. Don't do it. No worries.
No, sir. I have not qualified NEET. So
Which NEET? Acha, this first NEET.
UG.
UG was, trust me, वो मुझे point blank answer सुनना हो, then that may cause trouble. That can cause trouble. Definitely. Now it is like unless and until, I mean, you completed it, right? You get the admission, you complete your MBBS, and then you go for USMLE, because then for you, there is no other option but to go for USMLE. You have to do it. Because otherwise यहाँ पे MBBS खत्म किया in whatever the country you do, but then what? India won't allow. They won't allow.
If sir, I have done MBBS in Georgia, then I have given USMLE, and then after practicing in USA 3 years, then can I come in India?
Most welcome, because you had done USMLE, na? So USMLE is valid. So then no one would be asking you. That is a much higher exam.
That was only my doubt.
So that you can definitely do, because USMLE is bigger one. That is definitely over there. But then you have got no other option but to go for USMLE or PLAB दूसरे किसी देश में जाके. You have to do the post graduation and then return in case if you want. But it means out of 10,000 hardly anyone returns. Hardly. Unless there is some specific reason. Otherwise कोई वापस नहीं आता. It is not only the matter of money only, but the facilities and what you get. यहाँ पे तो आप देखो ना, recently तो in our group तो there is so much of discussion which is going on. In one of the hospital, patient died. So patients, they came with weapons, means chura and talwar and everything. Doctor is badly injured. He's from our batch. He is stabbed. बच गया. But then they are telling कि क्या? The patient was of 89 years. उनकी the great grandmother, and she was having multiple problems already. मतलब कुछ, there was paraplegia, and on top of it there was severe diabetes, blood pressure. The kidneys, they were not functioning properly. As such, when she came, and they said कि नहीं वो तो खुद चल के आई थी. He was having CCTV footage. चल के आई थी मतलब दो लोग ऐसे पकड़ के उनको लेके आए थे. And it was difficult. And then she went into MOF, multiple organ failure. And when MOF starts, no one in the world can save them, because kidneys, they stop working, liver stops working, right? There is massive fluid accumulation into the lungs as well as into the abdomen. Urine output stops, blood slows down, heart stops working. So it's organs, they start failing one after the another in the sequence. So within 24 hours, so game is over. And in such critical cases, you can't even do surgery, you can't even operate. The patient's weight was 41 kilogram. Age 85 plus, patient's weight 41 kilogram with so many problems. It's not like a miracle with patient aa gaye. These such things you don't find in other countries. यहाँ पे in civil hospital तो at times you also feel that heat, especially during the riots. When there were riots, then at times you have to be blunt. You have to be blunt. मतलब there is a big queue and everyone is injured. मतलब सभी कुछ ना कुछ इंजरी लेके आए हैं. But then you find that one person who is shouting so much, right? And then there is one other person who is sitting silently. आप पूछो दर्द हो रहा है? नहीं साहब, इसको पहले लो. The reason behind it is the severe nerve injury. The nerve has cut down to so much level कि अब कुछ भी नहीं है. मतलब that's why he's not getting pain. When someone is shouting so much, that means it is only superficial abrasions, because nerve endings are open, so that's why he is shouting, right? But there is the criticality of the injury is less. Patient don't understand that. They say कह रहे उसको कुछ नहीं था, दर्द नहीं था, उसको मुझे इतना pain, ये pain, all those. It happens. And then if there is some influential person, he'll come up, मैं देख लूंगा and all sorts of things. Happens. It's part of the whole game.
So there are no laws to protect these doctors who face such circumstances.
Yes. आप एक बात बताओ, मैं आपको मतलब this is because आपने पूछा इसलिए मैं बोल रहा हूँ. This is a very blunt reality. You go to, I mean, ये जो पार्लर होते हैं ना, ये हेयर सलून और हेयर पार्लर और वो ये तरह तरह के, right? In all those hair spas etc. क्या चार्ज करते हैं? They charge royally. मतलब पता नहीं किसने मुझे बोला था, हेयर कट का दे चार्ज 5,000 रुपीस. इन मुंबई में कोई है, कुछ अच्छा सा इनाम था, बट आई डोंट रिमेम्बर इट. 5,000 रुपया, राइट. हेयर स्पा, मतलब ठीक है, चलो. देयर दे पीपल स्पेंड. लॉयर, इसने बोला कि मेरा इतना चार्ज, यस, पीपल से वाह इट इज सो सक्सेसफुल, बिजनेसमैन ये दिस. बट व्हेन द डॉक्टर डिमांड्स, तो देन इट इज कि डॉक्टर लूट रहा है. व्हाई दे डोंट से कि लॉयर लूट रहा है, ये हेयर स्पा वाले लूट रहे हैं. नो. एंड ओवर यहाँ पे कुछ हुआ, लॉयर केस हार गया, तो ठीक है यार, अपना केस ही वीक था. बट इफ दिस थिंग गोज रॉन्ग, इट इज द गलती ऑफ डॉक्टर, राइट. इफ डॉक्टर यूजेस गुड कार, तो ये डॉक्टर बहुत लूटता होगा. इफ लॉयर यूजेस ग्रेट कार, वाह क्या बढ़िया. Anyone in any other business, because there is a total discrepancy, the total difference. That's why it is said कि medical में तो उन्हीं को आना चाहिए, those who are really passionate कि ठीक है यार, अब सीखना है and want to do something. But otherwise, yes, the number of years which you are spending, किसी को मतलब they feel कि अरे बस जरा सा ऐसा लिखा और 1,000 रुपया ले लिया, just एक दवाई लिखने का. So what everyone is doing, they are also, it is the skill which for which you are paying. But medical में तो ये रहेगा ही. People would, there is no law, there is nothing which is protecting the doctors from such people. इसीलिए तो I would say as the time would go by, things are improving and things will improve. But yes, सभी तरह के experience होते हैं. So that's why it is not easy to remain in medical. जो कहते हैं ना कि your willpower, it matters the most, because see, patient is in front of you, ECG निकला, and then within those seconds you see the ECG, you decide that what it is and you have to take action. Right? It matters the most. बाकी कहाँ पे ऐसा है दूसरे किसी में, हाँ ठीक है कल आना, वो दर्जी है कल आना, कल देंगे. बाल में कुछ प्लस माइनस हो गया, who cares, वो सब हो जाता है. Right? In any of the other field, but in medical, it becomes critical. You are a cardiothoracic surgeon, artery कट गई, you have to handle, you have to manage. That's the reason that your knowledge, it should be at par, so that you feel safe. All these things what you are learning, you'll feel so good when you'll be coming in practice. You'll be so happy. And now the things are improving much. Even the hospitals, they are giving good security. But ये तो जो हुआ था, it was in some very remote village. Some remote village. But happens, yeah? कभी होता है. वो तो आपने सुना ही होगा कि ये even Ola, Uber, females are up now. There is one app. There is one app also. Every female should really install it. I'll message it, which app it is. There is one very good app. You just press one button and immediately, automatically, your location, it starts getting tracked. Call goes to police. Call goes to the 100, right? Police. They contact the nearest police station, mobile van, and they reach to that location under 5 minutes. Recently, there were 2-3 incidences in which the Ola or Uber cab drivers, they tried to misbehave with a girl. So immediately she pressed that button, and within no time the police came, arrested all of them. So very important. मतलब ये तो क्या है कि you need to keep your eyes and ears open. But well, that is. But similarly, ये भी है कि एक बार आपने मेडिकल में काम किया ना, उसके बाद rest of the fields they become very easy. I tell you, after doing my MD, when I went into the field of cyber security, so then many times people used to ask कि आप इतना ध्यान से और इतनी डिटेल में क्यों पढ़ते हैं? आदत पड़ गई, मेडिकल ने आदत डाल दी. Whatever you do, learn the things thoroughly. So बस that gives you the cutting edge for rest of your life. All right. So it's always a pleasure to talk to all of you. Thank you so much.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir.
Sir,
Thank you, sir.